going to be talking about fertility preservation. So what is fertility preservation? Fertility preservation is the process of saving or protecting eggs or sperms or any reproductive tissue so that a person can use them to have a biological child in the future. Now, who needs fertility preservation? Again, there are two reasons for fertility preservation. It could be a medical reason or a social reason. Let's first talk about the social reason for fertility preservation. Now, so social reason would basically be somebody who wants to delay childbearing. Now, who are the patients who would prefer to delay childbearing? It could be because either they lack a male partner. It could be because of lack of job stability, talent drain, that is they're shifting their place from one city to another. They want to settle in their life and then get back, or it could be a desire to just enjoy life before they have a child. So what happens when you delay childbearing is there is a decrease in ovarian reserve in women especially, and also whenever there is a decrease in ovarian reserve, there can be reduced quality of the eggs, and this can lead to increased aneuploidy. Aneuploidies are basically genetic disorders that can occur when you have a child at a later age. So what is a biological clock? When we talk about a biological clock, as women, we generally see that you would have heard the elders saying have a child at an earlier age. Now that is because what happens is when you're born, you're born with a certain number of eggs, and that's all you have for the lifetime. So production of eggs take place much earlier. That is when you are in your mother's womb in the 5th month. That is when the egg production takes place, and after birth or after puberty, only utilization of the eggs can occur. So eggs cannot be produced after birth. So hence, whatever you have that much for the lifetime. So once the utilization starts to occur, the eggs will start draining. So within that reproductive age group, you need to conceive. If you do not conceive during the reproductive age group and say you have crossed that time, and you're, like we say, the biological clock has ticked, you will either have low number of eggs or the quality will be very poor. So hence, if you can preserve your eggs before trying to finish your career or whatever ambitions you have, you can probably preserve your eggs. So the eggs will be of a younger age, a better quality, and hence better results. Now, who can benefit from fertility preservation? We're looking at the medical reasons for fertility preservation, especially cancer patients. Now, patients undergoing cancer treatment like chemotherapy, radiation therapy, surgeries for cancers can be offered fertility preservation. Now, cancer treatments, what happens is when you use these kind of chemotherapeutic agents, these can cause damage to both the testis and the ovaries in men. So this also, so basically it reduces the quality of the eggs, quality of the sperms, also reduce the ovarian reserve, and some of the patients may undergo early menopause. Now, cancer treatments of late have, been used even in prepubertal, that is younger children. We are seeing that prepubertal kids are having cancers for which they are using chemotherapy and radiation therapy, and hence this fertility preservation can be offered to younger children as well. Who benefit from fertility preservation other than the cancer patients? We're looking at other medical reasons like autoimmune diseases. Now, autoimmune diseases, we look at SLEs, rheumatoid arthritis. There are many autoimmune diseases. Now, the treatment for autoimmune diseases also may involve some chemotherapeutic agents, and hence that can also cause damage to the ovaries or the sperms. The patients with endometriosis. Now, a woman with endometriosis, we have seen that there are patients who have undergone multiple cyst removal, that is endometriotic cyst removal. And whenever there's a cyst that is removed from the ovary, there always is a part of the ovarian tissue has also been stripped off. That itself will bring down the ovarian reserve of the patient. Endometriosis is known to decrease the quality of the eggs as well. So when we see early age endometriosis, like women in their early 20s with endometriosis, say they're not married, and it's a severe endometriosis, in these cases, we always offer to preserve your eggs. Patients with low ovarian reserve, either you've done a test which is showing you that you have a low ovarian reserve, or you have a family history of premature ovarian failure. So say your mother had early menopause, or you have a sister who's undergoing treatment or who already has a premature ovarian failure, then it's better to get tested to know whether your ovarian reserve is good enough, whether you could wait, or can we go ahead and preserve the fertility by doing egg freezing. and also patients who have ovarian surgeries. Now, we have some patients who've undergone ovarian surgeries for multiple reasons, medical conditions. So in these cases as well, we say that if there is a possibility to preserve the ovary, we do fertility preservation surgeries. If that is not a possibility, then can we freeze the eggs before undergoing the surgery? So these are the reasons why you can go ahead and freeze your eggs or preserve your sperms. Now, this has to be discussed with the patient, and it is important for the family members to understand that, especially in prepubertal children. So it's better to it's important for them to understand that fertility preservation is important, because most of these treatments cause problem to the sperms and the eggs, and hence later, maybe 10 years later or 15 years later, when they actually want to have a child, the quality is less, or the number of eggs and sperms are less, and they might not be able to conceive at that point. Hence, if you can preserve it at an earlier age, it will be of help to the patients. Now, coming to the main, why are we having this talk? Now, this talk was decided because, one, I want to increase because since there has been an increase in incidence of cancer patients during the reproductive age group, especially, we are seeing that the cancer rates are increasing day by day. So hence, we know that these patients are undergoing treatment. They are taking chemotherapeutic agents, and we are in touch with oncologists as well. So when you sit and speak to your oncologist regarding your cancer treatment, you should also, if you're at a younger age, you should also be aware that we have fertility preserving treatments, so that then the oncologist will put you across to a fertility specialist to take this forward. Survival rate and cure rates of cancers are also improving. So at that point, probably when the patient has been diagnosed with cancer, maybe the patient is not aware, or they're not even looking at fertility as an option at that point. But you should know that since the cure rates have increased, there is a possibility that 5-10 years down the line you might want to start a family, and hence, if you can preserve your fertility with the help of egg freezing or sperm freezing, that has to be discussed with your oncologist. And 1 in 1,000 adults is a survivor of childhood cancers, and hence the need for fertility preservation. Now, also, the delay in childbearing, there has been a shift from late 20s to late 30s now, mostly because of either lack of partner, or you want to settle in your career, whatever the reason could be. Since that shift has occurred, it is better to freeze your eggs and have a healthy pregnancy at a later date. Now, also, this talk is basically to bring awareness about the fertility preservation options that are available. What are the types of fertility preservations? We look at male and female fertility preservation. When we look at male fertility preservation, sperm freezing, that is sperm cryopreservation, it's an outpatient procedure, simple, most effective way, and low cost. Other than that, we have gonadal shielding during radiation therapy, and testicular tissue cryopreservation and reimplantation, after the cancer treatment. But this is more in experimental stages. So since for male fertility preservation, the most easiest method is sperm freezing, and it can be done within a day or two, and you can have multiple vials or straws of sperms frozen and kept, and this can be kept for a long time. And when we look at female fertility preservation, we're looking at egg freezing. Now, egg freezing, especially, we offer egg freezing if you do not have a partner. But if you do have a partner and you need egg freezing of preserving your fertility for any reason, then embryo freezing is always better. We again have ovarian tissue cryopreservation, fertility sparing surgeries, and gonadal shielding. Now, when today's topic, we will be mostly focusing on egg freezing. Now, what is egg freezing? Egg freezing also is a technique used to preserve fertility by taking eggs from a healthy individual, and we freeze them for a period of time. Now, what is the best age to freeze eggs? Earlier the fertility preservation is done, better the success rate. Now, that is because the younger your age is, the better the quality of eggs, and hence and also the number of eggs, and hence the success rates increase. Ideally, we ask patients to freeze their eggs before the age of 35. What is the procedure that involves egg freezing? First, you need to consult a fertility specialist. Then we will determine, with the help of blood tests and ultrasound, what is the ovarian reserve of the patient. Once we determine the ovarian reserve, we will give the patient some pre-medications to help improve the quality of the eggs. Also, we help to tell the patients in terms of lifestyle, what changes need to be made for that month or two, so that it can improve the quality. And then we start something called as controlled ovarian stimulation. Here we give hormonal injections which help in increasing the egg numbers for that month, so we will be able to retrieve them. Now, egg retrieval is again a procedure that is done under anesthesia. It's a 5 to 10 minutes procedure. It's a needle prick, hence no pain. And after the eggs are retrieved, the embryologist, that is a lab, will be attached to our OT. So the embryologist will screen these eggs. They remove the cumulus and they will freeze these eggs. Now, these are the steps. So first, you will have stimulation of the stimulation, that is injections or medications will be given, and then injections will be given. Injections are generally daily dosed. So they're about 8 to 10 days where you'll be taking injections, and they will have scans, about 4 to 5 scans in between to assess, and also blood tests. Once we feel the eggs or the follicles are of a certain size, we decide to give a trigger injection, which will mature these eggs. Once the trigger injection is given, 35 hours after that, we will retrieve the eggs. Now, egg retrieval, like I said, is under anesthesia. It's a 10 to 15 minutes procedure, which is with the help of a needle. And once these eggs are retrieved, we take them to the lab. Egg freezing is done. This process of cryopreservation called vitrification. Once the eggs are frozen, then you're good to go back on the same day after 4 to 5 hours. These eggs can later be used for conception. Now, egg freezing is again an option in the sense that you're freezing them, but you don't have to really use them when you're planning to conceive. You can try naturally at that point. If you do not conceive at any point, then you can use these eggs. Now, what we do after once you plan for pregnancy, we have to do something called as in vitro fertilization. In this, we take the eggs which are frozen, we thaw them, and your husband or your partner will come and give the sperms. These sperms will be injected into the egg by a process called as cytoplasmic sperm injection. And we will keep this embryo in the lab for 5 days. So first day we look at fertilization, then how the embryo grows. 5th day, a blastocyst is formed, and this can be later used to be transferred into your uterus. And for that, we will be doing a process called as frozen embryo transfer, wherein we will prepare your endometrium lining. And once the lining reaches a certain size and there's a good blood flow to the uterus, we transfer these embryos back into your uterus. It takes 14 days to know whether you have conceived or not after this procedure. Now, is it better to preserve eggs or embryos? We always say that if you have a partner, please preserve embryos, because since the technique for preservation in terms of the stimulation of the eggs or injections and the anesthesia part, everything remains the same. So if you have a partner, please preserve the embryos, because the embryos are far more superior in terms of quality, and also they can withstand the freezing and thawing process in comparison to an egg, because when we freeze eggs, there is a possibility that some of the eggs can lose their vitality and they might not survive. Not all, but yeah, few of the eggs may not survive after thawing. Hence, embryo preservation is always more superior if you have a partner. So what are the advantages of egg freezing? It always allows women to preserve their fertility, can also reduce the pressure on women to have children at a specific age. As women age, the quality and quantity of eggs decline. So it gets harder to conceive. Thus, egg freezing increases the chances of having a healthy pregnancy. So the take-home message from this session would be that fertility preservation is an option for people with certain diseases, disorders, and life events that affects fertility. This option can also be proposed to prepubertal patients. Better to preserve before the age of 35, and aggressive early screening of ovarian reserve and sperm parameters is a must. Success rates can vary depending on multiple factors like the age, lifestyle, endometrial, environmental effects, and medical conditions. Also, to just give you 2 or 3 cases that we have seen of late, is one with patients having low ovarian reserve at a very young age. So though we say menopause hits a woman at the age of 50 and median age is 51 in India, we are of late seeing quite a few women reaching menopause at a very early age. So we have had patients where they're at the age of 21, 22, and they have either just gotten married or been trying to conceive for a year or two. And when we check their ovarian reserve, we see extremely low reserves, or they come in saying that they're having irregular cycles, but when we check their AMH, that's a hormone which looks at the ovarian reserve, they are almost close to zero. And these patients are actually reaching something called as premature ovarian failure. Now, not everybody is going to check their AMH. So we always suggest that if there is a change in your cycles or your cycle length, it's always better to please meet a fertility specialist to know whether your ovarian reserve is good or not. If you have your mother or your sister or any family members with a known early menopause or a premature ovarian failure, please check your AMH levels and get a ultrasound done to look at the antral follicle count. Now, we have had patients with such early age, at age of 22, 23, reaching menopause. In these cases, when they've already reached menopause, there's nothing much we can offer, because when there are no eggs left in the body, there's no question of preserving the eggs or trying for an IVF at that point. In that case, we have to only use donor eggs. So the earlier you realize or you can figure your ovarian reserve, we see that the chances of conception is better. We have had patients where they have preserved their eggs at probably a younger age because of the other factors, and they have come back to us after 5 years, used the same eggs, and have conceived. So it's very important that you get at least a pelvic ultrasound done when you're at a younger age, so that we can at least assess your egg numbers, or also we get to know whether you have anything called as endometriosis, since it's endometriosis is also a condition which sometimes can present very early by showing us symptoms, but there are many patients where there are no symptoms at all, and we realize that they have endometriosis only after probably doing a scan after probably 10 years of married life. So in that case, we are losing out on the eggs, we're losing out on the quality, and again, own eggs might be a problem in terms of quality. So if you have any condition of endometriosis, please go ahead and freeze your eggs, rather than just doing. So what happens is most of them go get a surgery done, and they think that's the end of it, and it won't recur, but endometriosis is known to recur. So hence it's always better to freeze your eggs when you have endometriosis. And also one more case where we have seen one of the male patient who was married for a year but had low sperm quality and count. The patient ended up having something called a seminoma of the testis. That's a cancer of the testis, for which they will remove the testis. So before he underwent the surgery, he came to us and we did the sperm freezing for this patient. And seminoma has a good success rate in terms of survival rate, cure rates. So the patient did get cured with the after the testis was removed, and he did undergo some therapies after that. After 3-4 years, they came back and we've used the same semen sample which we had frozen 4-5 years back, and the patient's the wife could carry the pregnancy forward, and she had a healthy delivery. So these are just small cases, just so that you understand why this fertility preservation is of importance. And if you have anybody in your vicinity, could be your friends, could be your family, who are having any of these medical conditions or are delaying their pregnancy, it is always better to preserve your fertility at a younger age, so that you can have a healthy pregnancy at a later date. So this is just I thought this was a good message. Let's stop rushing to find husbands and start rushing to freeze our eggs. Thank you.
Thank you, ma'am. Thank you for your valuable time. We'll end this webinar here. Any concerns or questions that we'll receive on our chat, I'll forward it to you, and you can answer them later.
Sure. Thank you.